I just want to ask, and it's really open for any of you, talk to us a little bit about the impact that the Dobbs decision is really having on all the states where abortion is still legal, and states like mine that had limited infrastructure to serve our own community that are now being, really having to provide services for multiple states around us as well. And so talk a little bit about that dynamic, and I'd love your thoughts as well on just the impact that, logistically, that travel is having on patients across the country.
Yeah, as someone who practices in an area that does have access, and we're very fortunate in that we have a lot of support here in DC to be able to continue providing care the way we are. I can tell you what it means is that there's increased demand in these places. There are higher volumes. There are delays to being able to access care. There are longer wait times. For patients, there are higher costs associated with traveling. For providers who are trying to accommodate the increases in volume that they may be seeing, it oftentimes means that you've got to relook at your schedules. You have to figure out, how do I change my workflows? How do I change my staffing model so that I have enough people to be able to take care of the patients who are coming to see? What days of the week do I need to now be open? What hours of the day do I now need to be open? And what that translates ultimately into for some places is overwhelm, absolute overwhelm. I mean, there are places who have had to open brand new centers to be able to accommodate the volume that they have coming into their areas. And because the desire is so strong to be able to help everyone that you can, anyone that you can, we're often willing to push boundaries and push our limits, both our personal limits and the limits of our teams, to be able to deliver that care.
Talk a little bit about what does a delay in care really mean for someone?
What that delay could be will vary depending on where a patient's trying to go. And, honestly, depending on where they are already in the pregnancy, that delay could mean the difference between being able to get an abortion or not. It could mean the difference between being able to get a medication abortion or having to being forced to have a procedural abortion that you did not want. It means sometimes delays in care can result in procedures potentially being more complicated because someone is further along in their pregnancy. The cost most certainly goes up as they get further into a pregnancy. And so when you're delayed because you're trying to get an appointment somewhere, or even just navigate the logistics of travel to get somewhere, then by the time you get there, you're oftentimes in a much more difficult situation than you would have been had you been able to get the care earlier. And those delays are, again, despite the best efforts of providers who are trying to accommodate as many patients as they can.
Thank you all.
Can you speak a little bit to the emotional impact, not just the physical impact of delay?
Yes, and Dr. Denard, I'm absolutely sure, can speak to this as well. But for patients who, whether they made the decision to end their pregnancy because it's not the right time for them to be a parent, or because they were unfortunate to have a pregnancy that's being affected by an anomaly. Regardless of what the reason is, once you know that you need to end that pregnancy, you want to do it as soon as possible. And so when you're being forced to delay being able to get that care, the emotional and the mental toll can be tremendous. Dr. Denard can speak very much more eloquently to that, I'm sure.
Speak. You can speak from a personal perspective.
Personally, in addition to just the absolute heartbreak of finding our diagnosis and knowing that I needed an abortion, I just would like everyone in this room to think about what it's like to have a surgery from someone you've never met. Yeah. It's scary. It's very scary. And even as an OBGYN, understanding the procedure, understanding that what I was going through was, as far as my abortion, was very, very low risk and I was in safe hands, it's just absolutely terrifying.